I did the semen analysis and it came back like 0. And I just kind of left feeling, fuck, what did I do?
I was told I was fine a few years ago. I'm like, I'm fertile. She goes, yeah. I was like, cool. After that, I went in there. She did the ultrasound and she let me know that I have diminished ovarian reserve. So I think it's just the roller coaster. They're like, I'm okay. And they're like, you're not okay. And I'm like, now you're okay. Now you're not okay.
What they're going through with their infertility journey, it can really happen to everyone.
Never go to a doctor because he's convenient. It's your body.
Yeah.
You only get one body.
Yeah.
The response from women was so overwhelming in a good way. They were just like, thank you for talking about this because no one else is.
When you start thinking about you're getting close to wanting to have kids, check your sperm, find out your baseline.
Welcome to Fertility and Other F Words, the podcast that tackles fertility, sexual health, and every topic in between. No topic too taboo, and no question off limits. I'm Dr. Amy Pearlman, board-certified urologist with expertise in sexual, hormonal, and genitourinary health, and co-founder of Prime Institute in Miami, Florida.
And I'm Dr. Larry Lipshultz, board-certified urologist, specialist in men's health and fertility, and professor of urology at Baylor College of Medicine.
Hey, so Larry, how was your week?
It was good.
Yeah?
It was interesting. We saw some fascinating patients, did some good surgery. In fact, I have an interesting story.
Oh, I can't wait to hear it.
Yeah, so this gentleman comes in to schedule a vasectomy reversal. But he tells us that we can't tell his wife that he's having a vasectomy reversal because he never told her he had a vasectomy. I know. So we have to tell her he's having a hernia repair. That's the only way he would undergo the vasectomy reversal, and we agreed to go along with it.
Yeah. Well, I've been in that situation before, too. It was putting in a penile implant, and
that's
he
tough.
didn't want to bring it up either. And I was like, hey, the good old hernia repair.
He didn't want to bring it up?
Some people just don't want to tell their partners. And as much as we would love to have the couple in our office to have like this fully transparent conversation, I think as doctors, we have to be respectful of any level of discretion our patients want. But that can be challenging. But a lot more people, I guess, are getting hernia repairs than actually are.
They are. And what did your patient tell his wife he was having done?
A hernia repair.
Yes, but I mean, mine makes sense. It's, it's the same area of the body and he doesn't have to demonstrate anything.
Yeah.
But after the hernia repair, he suddenly gets erections? I mean, come on.
Hey, there are some miracle surgeries out there.
And you do a good hernia repair.
Apparently, I do a very good
The
hernia
word's
repair.
out on the streets. All right.
I don't actually treat hernias.
Okay. All right. Anyway, what are we going to talk about today?
So today, we're going to bring you into some breaking bedside news. And what I love about today's discussion is you were a part of this news story. Any idea what I'm going to bring up here?
No, surprise me.
Okay. So earlier this year, you and your group at Baylor published an article looking at men who were on testosterone therapy that wanted to have children, and you wanted to figure out, does a certain medication regimen improve the sperm in their ejaculate? So you looked at 77 men.
Right.
Some of them were kept on testosterone. You added HCG and FSH, and the other group you took that were off testosterone, and then were also on the HCG and FSH regimen. And you looked at to see if that regimen could increase their sperm, concentration.
Exactly.
Yeah. And you found that it could. That's revolutionary.
Well, I mean, I think the revolutionary part was more of the keeping them on testosterone than the actual regimen we use. But if you look at what's going on in clinical urology, when a patient comes in their reproductive years, number one, the AUA guideline says do not give them testosterone under any
It's very
circumstance.
clear, very clear. Yeah.
And number two, the regimens for bringing them back are usually Clomid, which is a SERM. It's going to fool the pituitary to produce more FSH and LH. So I thought about it, and since we do have FSH and LH available from our compounding pharmacies, my thought was, why not just give them FSH and LH in the form of HCG? And even why not look at allowing them to stay on testosterone, because it should not make a difference. Right?
Yeah.
And turn out it did not make a difference. So the men who were on testosterone and those who were not on testosterone during their, what we call a reboot protocol, did exactly the same in terms of success. 75% of the men in either group ended up with good quality sperm, and it took much less than it did in terms of time than it did with men's on Clomid. So instead of looking at years, we looked at months.
Yeah, and this is really important because what people need to know, what you all need to know, is that if someone is on testosterone, that can wipe out the sperm in the ejaculate in like 10 weeks, right? It doesn't take that long to do that.
And often not that much testosterone in some individuals.
Yeah. And so the thought, or how urologists have been practicing and what's in the guidelines, is like, if someone wants to have a child, you definitely can't put them on testosterone. And if they're on testosterone, you have to take them off. But a lot of men don't feel well when they're off testosterone. You and I have had this conversation before. So you put someone on Clomid, and I was like, Larry, when you put someone on Clomid, do they feel great? Because I just don't see that in clinical practice.
I don't see it either. I see 1 out of 10 on Clomid experience improvement in symptoms.
Yeah.
Despite the fact that their testosterone goes up.
Oh, the labs look great.
And I think it's partly because Clomid contains an isomer that's estrogenic. And I think it cancels out the positive effect of the androgen-like isomer.
Now, in your study, you gave men 3,000 units a week of HCG, 3 times a week, right? And then you gave them FSH 75 units 3 times a week. Larry, how did you come up with that protocol?
Well, the 75 units 3 times a week is what's normally used in women who are undergoing ovarian stimulation. The 3,000 3 times a week, totally made up. Now, if you go to older literature, it shows that if you give 500 units 3 times a week, you will restore normal intratesticular testosterone. But we wanted to go beyond restoring, and we didn't know whether or not it would take more because of their downregulation from testosterone. So therefore, we chose a higher number. Now, looking forward, what we want to do is decrease the amount of HCG that we give them, but we think in some men we may have to raise the amount of FSH.
So it's really an art. You're still trying to figure out that exact protocol. But at some point, when you're looking at this, you just have to start somewhere and then see what happens.
And we know what we give works. So you become reticent to kind of dial back because then you don't know for sure if it's going to work. I mean, one of the criticisms of the protocol is the cost, right? Because if you buy branded FSH and HCG, it's an absolute fortune. We are lucky enough to work with compounding pharmacies that have that sell the same products but generically and made in-house for much less money. So the couples can afford it. And it's hoped as more compounding pharmacies get their biologic licenses, which are now demanded by the FDA, that we will have more access to less expensive HCG and FSH.
So it makes it more accessible. Now, one final question about this research. How long, like how many months do typical guys have to be on this reboot protocol before they might see changes in their sperm concentration?
So we don't start checking until 4 months. It's a full cycle of spermatogenesis. Usually we start seeing something by 6 months, between 4 and 8 months. And very commonly, they're back to normal by 9 months.
Great. So this topic is very timely because not only was this paper recently published, but it's going to be really the focus of much of today's podcast episode.
It's very important in the couple's treatment that we're about to talk about.
Welcome to today's episode. I am so thrilled to introduce a remarkable guest today, Christian Guzman and Heidi Summers.
Christian Guzman is the driving force behind Unfiltered, a fitness apparel powerhouse that began with his viral YouTube content in 2012 and has grown into a multi-million-dollar lifestyle empire. He now operates Alphaland, an expansive 18.5-acre state-of-the-art fitness complex in Houston that includes multiple themed gyms and has even launched his own energy drink called 3D Energy Drinks.
And Heidi Summers, also known as Buff Bunny, built her brand from the ground up, literally, designing her first pieces from her living room with no formal business background or outside funding. What started in 2016 as a passion project evolved into a fully woman-operated clothing line celebrated for its focus on body positivity, inclusivity, and empowering women of all shapes and sizes.
Despite their industry success, today's conversation isn't just about business. Christian and Heidi are here to open up about something far more personal and profoundly moving, an important story that is currently unfolding.
So let's talk about how Christian and Heidi ended up presenting to clinic. In 2022, Heidi went in to get checked because they had been trying to have a child and weren't successful. So Heidi goes into the doctor, she sees her gynecologist, and she's told, "You're good, you can have a child."
Yes, but then 1 year later, still not pregnant, Christian decides on his own that he should be checked. So he goes to another urologist. That urologist performed a semen analysis and told Christian that he had no sperm. He was azoospermic. So at that point, Christian was admittedly and understandably very upset because he didn't want to have a tested biopsy as the doctor had recommended. So he decided to get a second opinion, and he came to see me. I told Christian that I had seen this many times because we see so many men who have decreased sperm production because of testosterone. So I started him on a regimen of FSH and LH. And 9 months later, Christian's sperm count was back to normal.
So they're still trying to have a child. And despite the fact that you got his sperm counts back to a great level, they still haven't been able to get a pregnancy, right?
Correct.
So she goes back in, and now she sees a fertility specialist, and she's told that she has 1 egg. So this is a total shocker because just a couple years before, she was told 2 thumbs up.
Right. They told her she had premature ovarian failure.
Yeah. So that's where this story and this conversation begins today. And as we talk to Christian and Heidi, where they share this deeply personal story, it really comes to emphasize how, the importance of resilience and hope, and how important it is for everyone watching to understand that Heidi and Christian, they are on top of the world in so many aspects of their lives. But what they're going through with their infertility journey can happen to them, and it can really happen to everyone. And they have a lot of important messages to share.
Yeah, and I think an important lesson to learn is that keep going, don't stop, because there are usually treatments for both partners. So Christian, Heidi, thank you so much for coming talk to us today and being present in our podcast. You have a very, very complicated yet moving story that we'd like you to share with us as well with our viewers. So Christian, thinking back, how did this whole thing start? What was your first entree into addressing these issues?
So we've been trying to get pregnant for, at that point, about a year already. And Heidi had gone to get checked up and kind of had the green light where everything was good, quote unquote. And then after, trying for a year and just seeing no positive, motion, I went to a urologist just to get checked.
How'd you find just came out of a hat, or you
I just Googled, yeah.
Dr. Google
Googled near me, and I ended up going to 2 or 1.
It was 1, but
it was 1. And the very first one I went to, it was just I did the semen analysis and he came back like 0. And essentially that conversation, once he got the results, we went into the office, he was like, "You're not gonna have kids. We're gonna have to take a piece of your biopsy, send it in." It was just like a lot to digest at that moment. And I just kind of left after that meeting with the doctor feeling pretty, just very, very, fuck, what did I do?
Yeah.
And I guess at that point I had already had other friends in the industry that have, had medication to get back up and running.
So you knew there was a chance that you would be low?
I didn't want to believe there was a chance until I went and he told me. And I was like, okay. But I had never gotten checked before. I had never done it.
Well, you wouldn't have a reason to.
Yeah. And so the fact that I had known some people online that have had success after having low sperm, I always heard the term HCG, right? That's kind of that one word that would get passed around in the fitness industry, is kind of like the solvent to getting it fixed. But whenever I don't know, that wasn't like something that was suggested from that first doctor.
And just to put this a little bit in context, like this time in your life where you were getting tested, this was a busy time in your life. You were competing in a bodybuilding show, right?
I just finished one, yeah. I just finished a very long bodybuilding season, and we had the intention, as soon as I finished that season, I was gonna propose literally like 2 weeks after, and then we were really gonna start the journey to, getting married quick, start the family, and kind of get it all rolling. And so that's when it was kind of, okay, it's time to go get checked out.
And Larry, you were kind of asking, like, what is the locker room conversation when it comes to fertility, testicular health, and medications that people take to build muscle?
I'm surprised, because I would have thought that you would have known, being on steroids, that there could be a problem with sperm because all you guys talk. But it didn't sound like that was much of a discussed topic.
Well, who's leading that educational talk?
Well, not education.
Yeah, but who's leading that discussion?
But you said locker room
talk. Right,
talk.
Locker room talk.
Yeah, I mean, I think you hear side effects, and being on testosterone at that point when I went to go get checked was like 7 years or so, consistently. And so being on it, I mean, you hear the hair loss, hair loss getting sped up, you hear the sperm stuff, but you just never want to think it's going to happen to you.
Right.
Until you have to go get a hair transplant and the hair's gone, and until you have to do a semen analysis and you realize. So I don't even know what % of people how long do you have to be on testosterone to, kind of cut it off, and how quick does it decrease? Like,
it's amazingly fast.
No one
it's
really
amazingly fast for some people.
Yeah.
I've seen it
like
after
10 weeks.
Yeah. I mean, and they're gone. Or other people never go. So it's so hard to predict. So you left this doctor's office, haven't told things are really bad. And did you know where to go next? Did you have any idea what you were going to do next?
So I had texted a friend of mine, Brandon, and he's a client of yours, or patient, not client.
Right. That's okay.
Patient. And he immediately, he was a friend of mine from one of my gyms, and we've kind of known each other for years. And so he recommended me reach out to you.
Right.
And that's when we first got introduced. And
Yes.
and
Thank goodness.
Thank goodness. And it was a
Thank
really
goodness.
straightforward approach that, we just kind of stuck to.
So, Larry, when you see a man like Christian in your office and he's coming in and he's azospermic, no sperm in the ejaculate, and he's been on testosterone, that's pretty common for you to see in your office.
In my practice.
In your practice.
Yes.
Yeah. So how do you give that person more hope, right, than it seems like you got from that initial visit?
Right.
What's your conversation looking like?
Well, I mean, I share with him the fact that this is nothing that I haven't seen.
Yeah.
And this is something that we usually can treat. The one issue we have, which people don't talk about, is that 2% of all men who've never seen steroids are sterile, no sperm. Another 7 or 8% have very low sperm counts. So most of the time, we don't know what I'm going to get you back to. And there's no way to know. Now, when we treat people with testosterone, we're making them get a semen analysis before we start. So when they go down, if they go down, we know what our target is to bring them back. But anyway, you weren't there, you didn't know, so we didn't know what you were going to get back to. But I had a good feel, based on my examination and your history, that you were going to come back. And I told you, I think, early on.
No, I felt very confident after that meeting. So it's about 9 to 10% of men 2% that won't have any, but 7% that will just naturally have low.
Right.
And if they take medication and get prescribed, are they able to get higher, or?
No, they're going to get back to baseline. Unless the reason they were low is due to a hormonal problem that we can treat. So if a person gets treated the way you did, and they don't end up as good as you did, then we have to investigate, is there something going on in this individual that we can treat, right? But fortunately, we didn't have to do that with Christian, because he just came back, all the targets were hit even earlier, so that 9 months after I met you, you were back to perfect, which then brought you into your picture with the
Yes.
spotlight, right?
Yes.
And as I remember, and this is so interesting, I remember telling you early on, your wife needs to get checked. She needs to get some, see what her status is. And he said, she's really afraid of needles. She's not going to be able to do anything.
Yeah.
Do you remember that?
Yes.
So what happened? He came home and he's doing better. What made you go to see somebody else? So you had been told you were fine.
Yes, I was told I was fine a few years ago. I went into normal gynecologist appointment and I was letting her know hey, I want to have kids soon. And at the time I was 33, I believe. I was I'm 33. I just want to, make sure everything is good to go. And I didn't know the questions to ask back then. I wish I would have asked hey, how do my ovaries look? How many follicles do I have on each one? And
But how would you know? I mean, those are not things people know.
So I was like, how's my uterus? How's everything looking? She was like, you're good to go. I'm like, I'm fertile. She goes, yeah. I was like, cool. So those are the questions that I thought
That
I
was
had to
the
ask.
extent of the check that we got.
Right.
Mm-hmm. And so I left there feeling really excited. And then he had his first appointment. And the first doctor, I just felt was dancing around a lot, was very fluffy, if you will. I love people who are just black and white, blunt, just tell you honestly what the situation is. And I think that's what we really enjoyed about going to you, is that you were very honest in everything. You weren't trying to sugarcoat anything, but also saying things like, I've seen this before, I've helped other people. So I think that gave us a lot of hope. But I think him going to see one doctor and then going to you also inspired me to maybe I should get checked out by someone else, because maybe the first doctor wasn't looking for the right things. So I went to get checked out, was it a year ago?
December of 2024.
Yes. So, last December I got checked out. And I went to a fertility clinic this time. I was like, I want someone who can really,
And for my own, how did you learn where to go? How did you decide where to go when there's
She met a girl at the tanning place, and this girl recommended this place.
Hey, that's helpful.
It is helpful. So I did research a handful of places, and I have a friend who has gone through multiple IUIs and is going to be doing a IVF cycle soon. And so she was like, you will love my doctor. She is so sweet. She is so kind. She's so understanding. And since she's done multiple cycles,
and that's important.
and that is
Those are
important,
important.
versus just being like, I went one cycle, it was great. She went through many, I think it was 7 cycles. So I was like, oh, I'll just have an appointment with her. So we went to an appointment, and I will say walking in there, I just felt, and it's not her fault, I just think I wasn't ready to hear you have to do IVF, because I have a big needle phobia. So when I went in there, she did the ultrasound and she let me know that I have diminished ovarian reserve.
Just from the ultrasound, she knew.
Just from the ultrasound. Well, she did do some blood work as well.
Because
She's
I think, I'm not 100% sure, but I think they know more from the blood work about ovarian function than the ultrasound. I think.
I think she told me it was
don't
a
look
bit of
at
both.
me. Don't look
Yeah, so I think she did say based on this ultrasound, this is what it's looking like. But when you come back again, sometimes you're having a bad ovary day, if you will. And so we did multiple ultrasounds, but her initial instinct was I had diminished ovarian reserve.
Because there was very little eggs there was one egg.
And
only.
I should have had, I think it was 8 to 14 or something like that. But based on only seeing one, she was like, let's get some blood work done. So I have a needle phobia, so I needed to do some of my own personal work for a few months. Right. So I did that. Because I did try to go get my blood work done a few times, and I was like, I faced a lot of fears, but needles were the scariest. So I did take some time to myself, and when I was ready, I was very confident. I walked in there, got my blood work done, because I think the first initial blood work's like 12-ish vials or so.
It's a lot.
It's a lot. And knowing I would have to do 3 injections in my stomach every day, every other day blood draws, I'm glad I took the time, because now when I do IVF, it's not fun. But I go in with like a very peaceful mind. And so yeah, after the blood work came back, they did sit us down and let us know, like, is there a natural option? Like, there's always a chance, but we'll have better odds if we do IVF. So we've done 2 cycles now.
But when they told you that you had diminished ovarian reserve, did you understand what they were saying? I mean, because I wouldn't know if I went with my wife, I wouldn't even know what it meant. Did they explain it to you, or did you go look and read? I mean,
I think I went in there with such confidence, like, I already got checked out, so everything's going to be fine. So I think I went in there with not an ego, but I just felt very confident, like, I'm good to go. And so I think when she was like, ooh, yeah, we only have 1 egg. And I was like, what does that mean? And she was like, well, you should have 8 to 14. So just the logical part of me is like, okay, so my fertility's a lot less than the average woman my age. And as someone who's 36.
Yeah, and we didn't really know what questions to ask further there. It was kind of like, you have 1 egg, we need to do blood work to confirm. And then we were really scared to kind of, get the blood work right then and there. So it was like, I don't know, in that room was definitely pretty emotional when she walked out, for sure.
Yeah, I think we're just like, okay, the only option that we have is IVF, is kind of what was presented. There's like a slim to no chance of natural, but.
And I think what also kind of added to that is we had been trying to get pregnant. I knew my sperm was good for months before. So kind of, you were checking the test every, am I pregnant? It's kind of a lot of already emotion, hoping for it to happen, and then kind of hearing, oh, we can't even be, it's not going to work. So that's my perspective.
Yeah, I think it was just a lot of bouncing where it was they're like, I'm okay. And they're like, you're not okay. And I'm like, now you're okay. Now you're not okay. Now they're like, you're semi-okay.
Yeah.
So I think it's just the roller coaster.
Yeah, I can't even imagine what it's like to be on that roller coaster. I was freezing my own eggs a couple of years ago, and I have patients all the time inject themselves, and when it came to myself with a needle, I was literally pacing around my apartment, my dog's looking at me being like, just inject yourself already.
You can do it.
I was like, but I can't.
Yeah.
Because how am I going to stick that in me? And it's not just once, it's multiple times. And the medications are incredibly expensive. Every time I went to the pharmacy, I'm like, here's $6,000, And at the end, you still don't know what you're going to get. Yes. And I don't think until I went through that process, I understood the emotional lability that comes with fertility.
Yes.
And it is insane. I think a lot of people don't appreciate that until they're going through that process.
Yeah, and it's made worse by the hormones. Don't they increase your emotional lability?
Oh, yeah.
Yeah.
I was like, yeah, I've had a few moments. Yeah, I think the logical part of us too, I remember Christian, he was like, oh, okay, so we just do shots for 2 weeks, then we get an egg. And I was like, of course you'd say that. But a part of me was like, oh, that's not too bad. But I think one day in IVF cycle is like a week, I would say, trying to explain it. Every little thing feels like a massive thing. And that's coming from, we're both CEOs. We deal with a lot. We put out fires. We manage a lot. And it's like one little needle holds so much.
Well, I think for you, it's way more because it's like what's in that needle is affecting you in a whole different way, right? For sure. Yeah. It's not like apple style, if I'm talking HCG injection, it's very different, So you went through that first cycle. We got
1 egg.
And healthy? So, did they say it was a healthy looking egg?
It was a mature, healthy egg. And so I got really excited. It's always a hard situation. I think with the doctors, they're like, oh, it's a really good egg. But they're like, but try not to get too excited. But it's a really good egg. I'm like, okay. And so she called me as soon as she could and just let me know that it, I don't know the terminology for this. It was it partially fertilized. The NP1, again, she was giving me a lot of detail and I was learning a lot where she's like, sometimes she's like, there's a 10% chance it will develop into full fertilization. But more than likely it's not going to work out. So that was our first IVF cycle.
Yeah, it's kind of like each like if you pull one good egg, great looking egg, it has to pass like 4 or 5 steps to actually be like fertilized and like
So
implantation.
But so day one, the next day after they do inject the sperm into the egg, they're going to know if it's fertilized. So that's day one. They're going to call you and say it fertilized or it didn't.
Yes.
And so it fertilized. Not exactly 100%.
Yeah. So usually like the first day,
one,
the first one, they said it was a partial fertilization. Sometimes it's like it can grow into, there's a 10% chance it can grow into one. She's like, usually we just discard them, but you only have one egg. We're going to do everything we can for this one egg, which I really appreciate. But then after the 5-day incubation period, they said
there's nothing left.
There's nothing left. It never replicated the cells.
Right.
So then we took a week off and then we jumped right back into it. And this time they had seen 4 eggs, right?
There's 4 small ones, but one was...
There was 4 small ones, but my body was only responding to the medication for one of the eggs.
Right, so you have these immature... I'm just jumping in here. But you have these immature follicles that will become a mature follicle, which has to reach a certain size.
Yes.
So what was happening with you is one was maturing and the others were not maturing.
Yes, and usually when you do the injections, all 4 eggs will start to grow, and sometimes on both ovaries. But one of my ovaries doesn't really grow big eggs, and so I'm really only counting on one of my ovaries. So all the hormones I was injecting, it was really only growing one of the 4 eggs. So the second cycle, we were only able to get 1 egg. And then that one, they were like, it's a really good egg. And I was like, awesome. So the next day they called me, they were so excited. They're like, oh, it fertilized. And so we were like, okay, we're making progress, which is really exciting. But as someone that has, I've looked up the different percentages and they're always honest with me. They're like, we still have like other cycles to get through. And so I think it was like 5 days later, I knew with each day, I was like, because usually you can start seeing the cells replicating, but they were like, the max amount I think is 5 to 7 days. So on day 5, they let me know that the egg never replicated cells, so it didn't turn into a blastocyst, but it was progress from the last one.
Yeah. So there you are, finished your second cycle.
Yes.
That's kind of where we sit today?
That's kind of where we sit today.
Yeah,
so
and
now
then we took a month off. You did some... we were going to go right into it again, but we were traveling.
Yeah, we were traveling, and we could have started it right then and there, but we were kind of like, let's just take some time because it's a lot. And we had some like fun trips, and I was like, man, I really want to... I was like in the middle of the desert, and they're like, you can start taking the medication again. I'm like, I really just want to enjoy the sunshine right now. Right. So I figured I would wait a month.
So that's where we are.
So are you about to go back in to start again?
I think the next thing, we are thinking about trying out another doctor, since I was like, we could be doing 10 of these cycles, if we have to. So I think right now we want to try out a new doctor, one that you had suggested.
Yeah, I suggested somebody for you.
So, and we met him, he was great. And so we're like, let's try a cycle with him. And so I'm just waiting to get my period so that they can do is it HSG, the flush out?
Yeah, your tubes.
That, and then I think getting day 3 of my FSH.
Okay. So you have a plan?
We have a plan.
Okay.
There's always a plan.
So I have some questions. Can I hop in?
Yeah, I want you to. I was waiting.
So you both alluded to the fact that you wish you had known more sooner, or you wish you had known what questions to ask sooner.
Yes.
So Christian, I'm going to start with you. A couple years ago, as you're training for these competitions, getting your pro card, what questions do you wish you would have asked?
I wish I would have known, number one, what kind of blood work, when I get blood work, what should I be asking to kind of get from that, like actually understand from that? 2, how can I be sure I keep sperm healthy if I'm going to decide to take testosterone? Because when I started to take it, to my extent, I did as much research as I possibly thought I could, but it's like, you just don't, when you're in your 20s, you don't. So number 1 would be, how do I keep my sperm good? Number 2, I would ask would be, how do I do blood work consistently to be sure everything is okay and nothing's crazy elevated? And I think those would just be the 2 main ones, really. Yeah, those are the 2 main ones that come to my head.
Yeah. Someone asked me recently, Amy, at what age would you start checking someone's testosterone? And I say, anytime someone comes in, I don't care if they're 18 years old, hey, do you want your testosterone level checked? I'll ask them, you want your semen analysis checked? I will ask any man who shows up to my clinic, and I'm in Miami. So even if I have patients that are in their 50s and 60s.
How about your 81-year-old?
What? Am I 81-year-old? Well, I literally ask every single man who shows up in my clinic who's interested in testosterone, I say, are you interested in current or future fertility? And some of my patients who are in their, 60s laugh at me and they're like, I have grandchildren. I say, I make no assumptions. We live in Miami, because every once in a while, someone says, actually, I might be interested. And then we have to address, how do we keep your testicles healthy and help you feel well, and manage your hormones? And you don't have to choose between the two.
Yeah.
So I've educated young men in fraternities before. And it's so amazing because when you give people like a microphone and you give them the stage to talk and ask questions, they don't stop talking. So guys in this fraternity, they're like, hey, I'm on like 300 a week of tests. Like, can I still get someone pregnant? Yes, you can. Like, people need to know, yes, you can still get someone pregnant, but you can also become infertile in the process.
Yeah.
And so even for those young guys in their 20s, I'm like, get a semen analysis. Know what your baseline is.
Yeah. I think that's a huge one. And I hate that. I mean, we live in a world now where like people are starting to mess with steroids way younger and way younger. And so I think just like being more vocal about not just the side effects, but like the follow-up question is, what do I need to ask my doctor for? Right. I think that's a huge thing. And just like, I don't know. And it's also, I know a lot of people that are transparent with their doctors about what they're taking, but the doctor doesn't suggest to check these things.
Right.
And that's kind of like, people already feel like they're going out of their comfort zone and like, I'm going to tell my doctor what I'm doing. I'm going to be open and honest. But then if it doesn't take them anywhere, that's...
But you weren't under a physician's care in the beginning.
At the very beginning, no.
But you bring up a really good point. There are so many guys who are nervous about bringing this up to their physician, because what are most physicians going to say? Stop. They're not going to counsel that person on how do we actually do this safely. I mean, this is a big portion of your practice, right? Where you see a lot of guys that want to build muscle. And if they go to most of our urology colleagues, they're not going to be told how to do it safely.
But one thing, and that is, when I see a patient who comes in, who's under another doctor's care or from a low-T clinic, and they want me to take care of them, I'll do it. If they come in self-treated for no apparent reason, they have two choices. They go someplace else, or they stop taking, come back to see me in a couple of weeks, and I'll measure their testosterone. And it's going to be low, but I want on their chart evidence that I'm just not selling testosterone, because you don't want to be in that situation. That's really bad. It's a controlled substance, and you got to make sure what you're doing is appropriate.
Yeah. So I think, I think it's on, we have to educate people, just young men, right? That they should advocate, right, for their own health, ask for different labs. A lot of people think, I ask them, oh, have you ever had your testosterone level checked? And they're like, yeah, I get an annual every year. I'm like, that wasn't my question, because it's not part of any basic screening. You have to specifically ask for it. And some men have to beg their primary care doctors to check their testosterone. But I think, would you agree, Larry, every young man should be offered, if they want to know the information, a semen analysis, especially with fertility rates going down, and a testosterone?
I mean, I think I agree to the testosterone. I think they ought to be asked if they want to get a semen analysis, explained why, and then, it's patient choice.
Yeah.
But some people don't care.
Yeah.
Some people don't want to know. So, leave it up to the patient.
Yeah, of course. Yeah.
Joint decision making.
Of course.
Right?
Yes. I would never force someone to do a semen analysis, because what does that semen analysis look like? The experience of saying, here's a cup, go into the room next door, or so how is that experience for actually giving that sample?
I thought it was fine.
Yeah. In my office, we do have a separate room.
That's
and
nice.
And
good magazines.
No. And we have a woman who's in charge of signing people in, getting the information, et cetera.
Yeah.
So it's very professional. It's not, here's go into the bathroom, which a lot of offices do. They send them into the bathroom, and then someone else comes into the bathroom. I mean,
Oh no.
No, it has to be something that's you feel safe in.
Yeah.
So it can be done. I mean, he obviously did not have a problem.
So Heidi, what are some of the questions you wish you had asked earlier on?
I think some questions that I would have asked are, what does it mean to be fertile? I think, at my first appointment, I was just like, can I have kids? Am I fertile? She's like, yes. I'm like, okay. I think I wish she would have said, hey, normally at your age, you should have this many follicles. Right now you have this. Maybe it's a normal range, but it's the lower side of normal. I actually don't know how many follicles I had because I never asked, and she's no longer a gynecologist. She's moved into the ER and this whole thing. So I was trying to chase her down. Like, can you give me a little bit more information? But it was also a few years ago. I wish I would have asked, what does it mean to be fertile? And are my numbers normal for all of those check marks and benchmarks?
What about freezing eggs?
I think that was actually something that I had brought up, 6 years ago. I lived in San Antonio and I went to a doctor, and I think I was in my early 30s. I think I just turned 30. I was like, oh my gosh, I have to freeze my eggs. And he was like, no, you don't. I was like, I don't. And he was like, no, you're fine. And so also I was told I was fine at 30. And I did bring up that point of hey, do I need to freeze my eggs? 'Cause I do want to have kids, but right now I'm working on my business, career, but I know I want to have kids eventually. And at that point, I was also not really given a lot of information. I didn't know the questions to ask. I had just brought up freezing my eggs.
That's a really good point, though, that you had thought about it and didn't get much support from whoever you asked.
Yes.
Whereas that is something that more and more women are doing, I think.
Yeah.
Is that
Yeah.
right?
Yes.
Well, yeah, I mean, a lot of us are pushing off, having children. I know when I hit like around, 35, because every year I was like, oh, I should probably do it. And then I was like, no, I really need to do it now. And for me, it was the whole, I have to go in for ultrasounds. Like I have clinic. How am I going to get to the fertility center before I have to see patients and blood work and injections? It's a lot.
How did you manage that with being able to see people in person?
I realized that my patients were going to survive. I realized I'm like, you know what? Because oftentimes you have to ask like 6 months in advance to take off some time from clinic. And the earliest ultrasound appointment was like at 7:30 and I started, clinic at 8. And so I was like, you know what? I'm going to be a little late today, And maybe I would show up like 15 minutes late and my patient still did fine. But I was able to get the ultrasounds. But that was my biggest concern is like I was going to get in trouble at my work, and I work in a hospital, but just scheduling everything is a lot. And I think it's a big barrier for people actually going through with it.
Yeah.
And you only really understand that once you sign the paperwork that says, I'm going to do this now. Otherwise, I don't think anyone really understands what that process looks like.
Yeah.
And I think that's where early education is helpful.
Even just doing IVF, if we didn't run our own businesses, I don't know how we would do that.
Yeah, that's why we are so fortunate to we've worked so hard the last 12 years that we're okay, we're now able to take a step back and be able to focus on us. And I have amazing teams and I let them know. I still showed up to work, but there's a lot of times where I was like, man, I don't feel like I'm going to make a good decision today. So I'm going to try to ease back a little bit. Did you struggle with, I guess, the deeper that you go into the hormones, did you ever feel slow or just brain foggy?
I felt bloated.
Bloated too?
And even just feeling bloated, and I was operating at the time, you just kind of feel gross.
Yes.
And you don't want to complain about it because it's it's just bloated. Everyone feels bloated. But when you're bloated and you're busy, you don't like it. It's just
Makes
annoying.
it more uncomfortable. Yeah.
But my situation, it was only for it was for a few weeks. So I knew there was an end point.
Yes.
Which is different when you're going through this infertility journey where you don't know what that end point is.
Yes.
So it's, both situations are challenging and I think people don't understand until they're in it. Yeah.
I don't think there's enough information out there for young people.
In a way that people understand.
For instance, half the medical school class is now women. And these people are not going to be for the most part, thinking about pregnancy for quite a number of years. But no one goes to the class and says, for your women in the class, if you'd like to consider freezing your eggs, we have a program here at so-and-so where we support you by X amount of money and you'll get your drugs less expensively. Nothing. Crickets. And this is in the medical school.
Yeah.
You would think that they would be educating those young women as to what they can do and the benefits that they can offer.
Yeah.
But they don't.
Yeah, no, they don't.
I also think it'd be great to, the annual exams that women have to do, the pap smears and everything. I've done so many of those and fertility has never been brought up. And, all the doctors I saw in Alaska, San Antonio, Houston, none of them have ever brought up fertility or me being like, oh yeah, you are fertile. It's I always had to be the one to ask and press and then not really get clear answers or it was always kind of brushed off. But if fertility is declining, it makes me wonder why they aren't asking those questions to their patients, I guess, in those exams that most women have to do. It's they are either in a routine of doing every 1 to 3 years, especially if they're on birth control.
Yeah. Well, I think a lot of it is that most urologists and most gynecologists are not fertility specialists. So we don't like to ask questions to which we don't know the answers.
But that's urologists. Aren't the gynecologists, don't they have part of their training in fertility? I mean, they must know enough to ask
in
questions.
our field, in urology, most urologists don't care to talk about testosterone.
But that's different because women exams start when you start menstruating. Women start going for birth control. They have a doctor. They have a relationship usually. So they should, I don't understand why those doctors don't, like you say, I don't know why they don't ask. I mean, because they're giving you contraception. So the concept of fertility is out there. So why wouldn't they be flip it and say, someday you're going to want to have a child. Have you thought about A, B, and C? They don't ask.
Yeah. Well, I think in all of our offices, we have to ask our patients that. And if we don't specialize in that area, we have to make the referral early. Yeah. Both of you have been very vocal on your digital, media platforms about what you're currently going through. And it seems like you want to pay it forward to other people that are going through. What is your message for others that are currently going through infertility journeys as well?
I think for us, we've shared our lives online for 12 years, I think now. And we've shared a lot of different parts of our journeys. And I think Christian had opened up a few years ago, just kind of like, hey, we're trying to have kids right now. And he kind of shared his side of his struggle. But I waited a few years because I was kind of like, once I found out my news in December, I was like, oh, I'm not ready to share this online. I wanted to wait until I kind of knew what the path was going to be moving forward. I wasn't sure if I'd even ever share it online because I think it's a very personal thing. And the internet can be a very wonderful place, but it can also be a very scary place. And once I started IVF, I'm in the fitness world, I guess, on social media. And I just didn't want people questioning like, oh, are you pregnant? Or, oh, they're trying for kids. Like, are you pregnant yet? Are you pregnant yet? And so I know in IVF, you get really bloated. And if we were going to be doing multiple cycles, the doctor was very honest in saying, hey, this could be like a 4 to 6 month process depending on how the cycles go. She's like, it could be 1 and done. It could be 10 cycles. Like, we just don't know. So just prepare for it. And at that point, I made a YouTube video, and I was like, this is where I'm at. I'm sharing it just because I don't want people questioning, are you pregnant? I'd rather them be like, it's probably IVF. If, if I'm in a story, you see I'm like bloated or something like that. And I think when I uploaded that video, I was just kind of like, hey, just put it out there. We're starting IVF. I'll talk about it when I'm comfortable and like I have my boundaries. And that was kind of it. I just kind of put it out there and was like, all right, I'm going to move on with business and fitness and work on my IVF. But I think I saw the response from women was so overwhelming in a good way. They were just like, thank you for talking about this, because no one else is. Like, I'm going through it. I'm doing this. I'm too embarrassed or shameful to tell my mom about it, my mother-in-law about it. And I just saw the different women who were also struggling with it, but too scared to talk about it. Even like friends in my life, and even they were like, oh my gosh, I'm also going through this. Or, my husband also has 0% sperm, like we're feeling hopeless. And so I think after that, I started sharing things here and there as I'm comfortable with it. And I just didn't realize like how many women were struggling with it and hiding it as well.
Yeah, my biggest thing would just be to any guy, if you're in that, really, when you start thinking about you're getting close to wanting to have kids, check your sperm, find out your baseline. And I would say check your testosterone too. And just for me specific, but be sure the sperm is a main one. I don't think anyone is ever told to like check that, and they just assume they can get anyone pregnant at any moment and just use protect. Like, that's kind of like, that's all you hear. And then you don't ever think the opposite would happen to you.
We teach people how not to have kids.
Yeah.
We don't teach them how to have kids.
Yeah.
And I think that also delves into the whole lifestyle, like different decisions that we make other than being on testosterone, not being on testosterone, but the foods that we're eating, the supplements that we're taking, how we're moving our body. So what have the two of you learned in this journey about how to care for yourselves in a way that also like promotes fertility? Like in terms of like what you eat or how you exercise. Has that changed
at all? That hasn't changed for me. I've always eaten really, really like whole foods. I don't really eat junk. Training, I've always trained hard. And if anything, I would just say this shift in kind of realizing with the sperm and all this has sort of made me take I should also start doing cardio. I should start like caring about, can I run a mile like effectively? Or
you mentioned your sleep
not just be like a bodybuilder, kind of, digging eyes laser focused. Like, let me get good sleep scores. Let me like be a more well-rounded.
But I also think one thing that's important that you've kind of happened on is that maybe you should have been taking a shot of HCG all along once a week. So all my patients, I give them one shot a week of HCG, and we've shown that these people come back faster than someone who just has nothing.
Yeah. Well, so the interesting thing too with your journey is that you didn't take him off testosterone.
No.
You added, right? He added HCG and FSH to your testosterone regimen. Now,
and anastrozole.
And an anti-estrogen.
In our national guidelines for urology, it's like in there, like very, not in bold, but probably in bold,
clear.
Right? Clear. It's very clear that like anyone who's interested in current fertility or future fertility, you do not put them on testosterone. And what I love in some of our discussions in the past is you're like, but I'm doing the art of medicine right now. That is a very like one-sided approach. And could it be possible, you've asked this question, is it possible that I could still have my patient on testosterone and preserve his fertility?
Yes, and we found out we can. Because the problem is if someone's on testosterone and they come in, they're trying to have a baby, we need to bring their sperm count back. They don't want to come off the testosterone because they took it in the beginning because they were symptomatic. Not necessarily maybe somebody who's a competitor, but a guy who has low testosterone. So, we found out that we don't have to take them off. We can let
the
them
results
stay.
like kind of if you
Exactly the same.
Isn't that
exactly the
crazy?
same. Yeah, that's
Exactly.
That you
the same.
don't have to take someone off testosterone?
But you know what? When you think about it, it's so logical.
Yeah.
Because when you take testosterone, you turn off the hormones that are stimulating sperm production. But I can give you those hormones now. We have them. You go buy them. So consequently, there's no logical reason to stop the testosterone.
So his research is really changing the game when it comes to how we think about this.
Yeah.
The other thing I find also very interesting is that the medications we use for men are also the same medications we use for women when it comes to fertility and hormones.
Yes.
So I think it's really the shared experience that men and women, we're very different, but we're also very similar. And I think there's a lot of power in that to build a relationship that says, it's not just your fault. It's not just your fault, right? This truly is like a couple's thing. And we have to really address it in that way.
But it's so interesting you talk about the similarity because you guys don't know this, but if you look at an ovary and you look at a testicle, they have the same covering and they require the same hormones. And I personally believe, this is just me, that we have men who have premature testicular failure. That what you have is not just a women's disease. Now, we haven't shown that yet, but there are a lot of men we see who come in with their sperm count so low, we don't have a reason for it. And the question is, was it higher 10 years ago? We just don't have the data. But to me, it's just only logical. We should have something comparable.
And that's mainly genetic, would you say? Or is it food choices, lifestyle choices?
We don't know yet. I don't know if it's genetic because then to me, if it is, it's a new genetic thing that happens when the embryo forms. Because if you're passing it down from generation to generation, nobody's going to be having kids unless you have it young. But don't forget, men were supposed to have kids when they were in their late teens and women in their early teens, right? That's, biblically or going back, that's when people have their best fertility. So no one would have noticed that the 40-year-old or 35-year-old didn't have sperm anymore.
So Larry, going back to kind of the lifestyle, like what should people know when it comes to optimizing their lifestyle, right? These factors they have complete control over to optimize their fertility. What's your message?
So I'm not into the details like you are, but in general, I just tell my patients, anything that's good for your health is good for your sperm. Things that are bad for your health are bad for your sperm. And that should be your mantra.
Yeah.
I mean, if you want to stay fertile.
Yeah.
Alcohol, smoking weed.
Anything in
Unfortunately, there
all
were no redeeming qualities to alcohol.
No, wait a second. I don't think any of this stuff has to be totally stopped. But it has to be held in check and done judiciously, smartly. But you have a lot more insight into
Well, I talk a lot about
toxins.
nutrition and exercise because I find that it's not enough for me just to ask, do you exercise? Check. Do you eat healthy? Check. And everyone says they eat healthy. They're like, I eat regular foods. I'm like, okay, what do you eat for breakfast? I had a patient the other day that told me what he ate for breakfast. And then for lunch, he said lunch and then he skips to dinner. I'm like, no, I know that you ate lunch. What do you eat for lunch? And I'm not trying to be funny and I'm not trying to because patients aren't expecting to walk me through a food diary when they come into my clinic, and yet the devil is in the details,
Yes.
And a lot of people don't understand that anti-inflammatory foods are going to be really important, but no one knows what an anti-inflammatory food is. And what people need to understand, I think intuitively they know, is that fruits, vegetables, nuts, seeds, whole food, mostly plant-based, is going to be healthy. But the problem is they don't know why it matters. And so if I can tie in cardiovascular exercise, resistance training, and say, it's important that if you take one thing from my visit as a urologist, you're coming in for a completely different reason, but if you learn one thing from today, when you leave here, you need to start lifting heavy shit, And I say, and this is why.
Yes.
Because I'm like, you are so deconditioned and you want me to put a penile implant in you. How do you think you're going to have sex? If you are so deconditioned.
Yeah.
And so oftentimes we're lucky in our field. Because as urologists who specialize in sexual medicine and fertility, there is not a single thing that someone comes in with that they're bothered by that we cannot tie into creating a healthier life, But it means we have to really sit down with patients to understand, what are you eating for breakfast? And what are you putting in your coffee? And how do we optimize your protein intake? But that takes a lot of time, and I think that's a challenge.
And that's part of the problem because you're expected to see so many patients because there's so many patients
That's where
with
our fitness
problems.
influencer role comes in.
Yeah.
That's where our YouTube channels and our fitness mission to educate. I mean,
Right. You two are doing more than we're doing.
And that's the beauty of it, is that like when we all collaborate, we can all help the mutual person. We don't have to do everything ourselves. I'm not going to do exercise programming, but I'm going to tell them, go to your fancy gym, you know?
Right. And go several times a week.
And go several times a week.
Once.
Yeah. So, okay, let me ask you both this. Your roles as like social media influencers and CEOs and athletes, what is your role in educating like the next generation in living healthier lives?
That's a good question. I mean, my main thing is to get people lifting heavy stuff with good form and learning and like slowing down to realize like what good form is and not just like throwing weight around. I'm very big on you can make any food work, how to fit real foods into the diet and enjoy that. And yeah, I mean, that's really, it's like I cover the fitness stuff and a lot of business sharing is what I do as well. But yeah, I'm kind of just an open book, to be honest, on my YouTube channel.
Well, and you make, I saw one of your videos recently showing like what you get at the grocery store, right? And you make that a way that seems, I can do that too. You know, I can order groceries to my house, you know? And you make it seem like, I'm going to say like a sexy lifestyle change, right? That's where we have challenges, is how do we get people to actually change their behavior? One, we have to simplify it. And two, we have to make it seem like sleep is like all the cool kids now are sleeping a lot, you know, or getting their 7 to 8 hours.
But I also think part of it is to turn them on to role models. Like Christian and Heidi, because, you know, you are good role models.
Thank you.
Thank you.
Yeah.
So Heidi, what is your mission?
I think with my mission, very similar to Christian, is we don't, when it comes to educating, I would say like we're definitely more like lifestyle influencers. We're like, hey, we're showing how we incorporate health and fitness into our really busy lives. We are social media influencers, but we also are business owners and entrepreneurs. And I own 2 businesses. He owns like 4, I think it is. So it's we have a lot going on. And I think one of my favorite things that I share is that I'm like, hey, I live a very busy life. I love what I do. And I wake up every day so grateful that I get to do it and work on my businesses. But I also show like, it's a lot. And they're like, fitness is your job, so it must be easy for you to work out. I'm like, absolutely not. I wish it was. We just went on like 4 different trips back to back, all traveling. And things that I try to incorporate in like videos, it's like, hey guys, I'm at the airport. What's the healthiest decision I can make right now? And
that's tough.
It's tough, right? And so one of my employees saw it. She was like, oh my God, you're so gross. I can't believe you just got those boiled eggs in a bag. And I was like, well, yeah, it's either that or my Cheez-Its, which I do love my Cheez-Its too. But it's like I grabbed 2 boiled eggs and I got a protein shake. And I was like, you know, it might not be the best option right now.
It might not be grass-fed in this.
But that is literally the best option at the airport. I know, I've seen those.
Yeah, so it's like that. Or you can get like a green juice, and there's different things that you can get. And sometimes people just don't know what they don't know, and it's just like seeing it in a video, it sparks them, and they're like, oh, I can do that the next time at the airport. And then they start doing that, and it's like a snowball effect that makes them feel confident in being able to incorporate these lifestyle changes. And it's really cool to see because we've seen people. He has a bodybuilding show. It's called Summer Shredding, and there's this transformation category. And it's like they'll watch our YouTube videos, and we've seen people lose hundreds of pounds just watching the videos. They're like, I saw you guys meal prep, and I was like, I started meal prepping, and that changed my life. And it's just like I
tried this low-calorie I learned about this low-calorie barbecue sauce from a video, and I think just like sharing as many nuggets like that as we can is
really
like
important.
I love that.
I think my favorite thing is also like we're not preaching to them. I'm like, I'm not a registered dietitian. So like I only share so much, but one of my really close friends is a registered dietitian. So I'm like, hey, can you come talk on my YouTube channel, or can we collaborate on a speech? Because I'll share the more relatable stuff, but if we're getting like deep into things, I feel more confident having someone who specializes in that speaking on it. Because I don't want to say something that I didn't go to school for.
Well, you two have been fantastic. You know, we really appreciate it, because I know it's a busy day for you. It's Saturday. But this is going to be a very important podcast, I promise you. Don't you think?
It's so hard sharing such a personal story. It's like such a vulnerable thing to do. And I think that for people who already know who you both are, but for a lot of people who don't, like they're just going to learn what is that next better decision they can make? What is that 1 or 2 questions I can ask the next time I go to the healthcare provider? That knowledge is so valuable. And people don't know how to advocate for themselves. And so this is going to help people advocate for themselves. And even if like none of us in this room are treating those people, if they have the questions, we give them the power to advocate for themselves. And I think that is a huge takeaway message.
It is. It's very important.
Yeah.
And next time we have a podcast and Amy comes to town, she and I are coming out to the gym.
Yes.
Yeah, we can do the podcast there.
We are.
Perfect.
You know, there's one other thing that I think is very key. is it is okay to doctor shop. And that gets a bad reputation as healthcare providers.
Right.
We always make the comment, oh, that person's doctor shopping. Yeah, you should. You should continue to go to people until you find someone with whom you feel comfortable asking these questions. And we all, like, why should someone go to one doctor and just stay with that person and say, this person is going to know everything that I ever need to know?
I'll tell you what drives me crazy.
What drives you crazy?
When I see a patient, that comes to me and he's had a bad outcome. And I say, what happened? Well, I went to this doctor, so-and-so. I said, why did you go to this doctor? Well, it's close to my house. I said, never go to a doctor because he's convenient. It's your body. You only get one body.
Yeah.
I mean, there's these doctors all over the place.
Yeah.
Don't you agree? I mean,
No, I agree. And I think that's why I think it's important for doctors to get online so we can share our message. So people who are not regularly going to doctors know, like, oh, I like that person's message. I'm going to vibe with that person. You want to know, like, what our personalities are, because especially when you're going through something that is so personal, right? The doctor's personality matters.
Yes.
You know, what their office looks like matters. Is this comfortable? Are they going to work with me as I'm, like, you know, have this needle phobia? Like, all of those things matter. And I think that's on us as healthcare providers to, like, put ourselves out there more so people aren't surprised when they come into our offices.
I
I
agree.
agree. I come from a family that, like, my dad just, like, we would never go to the doctor, like, never. So just, like, going to the doctor, just, like, going to the doctor is already a huge step. So it's like the thought of, for someone like him, like, shopping around for a doctor, hell no.
Yeah.
You know, so it's just, one, get the courage to, like, go to the doctor, learn what questions to ask. And I guess, like, kind of how you're saying, like, knowing that there's outcomes and success stories that have happened, I feel like that'd be very useful for people to kind of hear. Because I still have friends text me like, hey, I got my sperm checked, not looking good. Doctor wants to get me off of tests. Is there any way that I'm like, oh, I didn't have to do that?
Yeah.
So maybe, like, shop around a little more, you know?
Thank you both so much for
Yes,
sharing
thanks
your powerful
again.
stories.
Thank you so much.
Yes.
Thank you for having us.
Oh, it's our pleasure. We'll see you at Athlete.
Yeah.
Alpha Land. Alpha Land.
Christian and Heidi's story shows how infertility can touch anyone and emphasizes the importance of early evaluation, honest communication, and persistence. Their journey is such a powerful reminder to advocate for your reproductive health.
Yes, their experience highlights that even the healthiest, most driven people can face fertility challenges. The key is timely testing, working with experienced specialists, and staying hopeful. There's always a path forward. So I guess the F word for today would be fecundity.
Yeah, I think that's a good word. All right, Larry, why don't you give us some foreplay for our next episode?
Okay, foreplay.
Yeah.
So next episode, we will be featuring Leela Brada, IFBB professional bodybuilder and founder of Labrada Nutrition. You won't want to miss it.
Thank you for joining us today on Fertility and Other F Words.
And don't forget to like, subscribe, and leave a comment.
Until next time.